Hi everybody, how are you doing today? Today is Thursday, June, June 4th. I've got no issues with my attention and my executive functioning. Well, I wanted to update you guys on a few things, so if I'm gone for like a week or two, you know why. How are you? I'm just resting right now. I'm okay. My symptoms aren't terrible. I'm sorry if I'm all over the place. It's not very professional, but this is where I'm at right now in my recovery situation and my doctor's appointments and whatnot. So if you're new here, my name is Sheri. I'm an adult with ADHD, probably autism, and I've been trying to recover from chronic illness and get all the doctor's appointments to figure out what's going on with that. I've been on a leave of absence, and I'm just kind of chronicling this journey because this is not unusual for people who are neurodivergent to struggle with some kind of health issue. It's different for everyone, but that doesn't mean you will have health issues. It's just not uncommon. So sometimes showing how I'm dealing with the overwhelm and the different things I'm using to help myself might end up being helpful for you. So taking one for the team and showing myself at my worst. But in any case, I hope you guys are all doing really well. I've talked with some of you guys in comments here and there, and I want to shout out to Celtic Phoenix, and I want you to know I've been thinking about you, and I hope you're doing okay. So if you see this, please, if you're doing okay and you're safe, send a comment when you're up to it and let me know how you're doing. Show her some love if you see her. She's been struggling too. So I've got a lot going on right now. A lot. So my baseline, here's the good. If you want to do good and the bad, the good, the bad, the ugly. The good is my baseline seems to slowly be getting a little bit better. So an update for this week, Tuesday. So what's one thing I want to tell you? So my prescriber for my mental health medications had increased my antidepressant several months ago because of a situation with the pharmacy where something didn't get filled in time, combined with me being stuck in bed for multiple days. I ended up going 10 days without an antidepressant that I've been on for since 2008, 2009. So that's bad. So I was dealing with being in the midst of a bad point in time with my illness where I couldn't really get out of bed, and I was so sick that I didn't know I went through the withdrawals of that. Now, that was in March. Since then, I had detoxed from that, and if you're a woman of menopausal age, that actually affects how well your antidepressants and your ADHD meds work, because you need the estrogen in order to make, there's like other ways your body can make them, but it doesn't work as well. So your neurochemicals will be lower. So you might find if you have ADHD that your suddenly the brain fog is pretty bad. Like people who go through menopause, women who go through menopause, I mean, that's a well-known symptom, and that's probably why, because the regular levels of dopamine and probably everything else serotonin, norepinephrine, who knows? I'll have to do research and let you guys know when I'm feeling better and I'm able to start researching these things and give you educational videos, which I would love to do. I'll let you know once I see. At that point, it's going to be a while before I can do that. I really look forward to learning how to do actual videos instead of just vlogging from, this point of being ill and trying to get better. So the good thing is, I think my baseline is increasing slowly. I happen to be resting right now because I'm crashing a little bit, not medically. Just my energy is kind of crashing because I've had an intense 2 days. So if you have chronic fatigue or you're an autistic or ADHD burnout, as time goes on and you do all the things and you're eating the food and making sure you're getting your nutrition, you've taken any kind of doctor's appointments you can do, and it's really hard to manage all of those things. It's almost like having a chronic illness is in itself its own full-time job. Not only can you not work because you're not well enough to work, now you have all of these additional tasks which are incredibly draining between the doctor's appointments, and now you have to figure out, okay, I need to make sure I don't forget to eat, which is already a problem. I need to have reminders either on my phone or have some way. So now there's additional executive functioning tasks that were already challenging for you, but now it's more important that you follow them. Plus, and then forgive me if I do bounce back and forth. It's all important. It's just, with my symptoms, I might go back and forth and apologize. So stay with me for a few minutes because this is all important. And some of this I've already talked about, so I apologize if I'm repeating myself with some of it. Hold on. It happened. I already lost my thought. Okay. So, talking with my therapist, trying to figure out, okay, how am I even going to manage all of this? Having to figure out how to keep track of these doctor's appointments. Here's my next couple weeks. This is kind of intense. So Tuesday, I started feeling better. I'm taking this new medication. He put me back on the medication I was forced off of because of me not realizing I went 10 days without because I was very sick and couldn't get out of bed, and they didn't fill it in time, and that's a whole other thing. But anyway, I've already detoxed from that, and he wants to put me back on it. So I've talked about it before, how I was conflicted. So at first I didn't start taking it again, even though he started me at half of the dose is what I was, because I was thinking that Adderall, the stimulant Adderall, the coffee I used to drink, and this one, which is bupropion, which also does the same neurochemicals as Adderall, just does it in a slightly different way. That's why sometimes they will prescribe bupropion which is Wellbutrin, for people who have ADHD. That's not the stimulant medication. I'm not sure how they're different, but it does affect dopamine levels and norepinephrine. So it's a stimulant as well. So after I detoxed from these medications, I thought, I wonder how much that was masking that I was actually dealing with an illness and had no idea, or even how burned out I was and had no idea. That I was pushing through, drinking coffee, taking B vitamins, emergencies, just pushing, because I didn't know I was burned out. So this whole thing has been a process of starting to reevaluate and learn, was I worse off than I thought? Did I have a health issue before and not know it? Or is this neurodivergent thing, am I more affected by my environment than I realize? And then I'm using these things to push through, because when I started taking them, exhaustion was part of the reason that we chose those medications. because we weren't looking at things back then through the lens of burnout. We were looking at it like I thought I was exhausted all the time as a symptom of my depression, because I couldn't figure out any other reason. In the last 10 years, before I even knew about neurodivergence or looking at autism or any of this stuff, I just knew I had ADHD and depression. I didn't know anything. I just thought I was oversensitive. All the cliches, right? So, yeah. But now that I have a different lens to look at everything, it makes me wonder, have these things been contributing to the problem? Because here I was tired thinking I was doing these things to treat myself, and they were too, because they weren't looking at this in the lens of neurodivergence or anything like that. Because I'm not somebody who is someone you would think that of. I'm asking, it's just been an enormous journey. It's crazy. And then with the health issues too, it makes me wonder, they feed into each other. So increasing that medication makes me wonder, because I don't know how much of that played a role. So if I was burning out before I think I was, and I was thinking it wasn't, because they were doing the traditional tests on me, they did blood work, and I'm like, I don't know why I'm exhausted all the time. So of course, what do you do when you go to the doctor? They check your they check if you're anemic, they check your thyroid, and of course, no matter what, they always check the same things. And I try to tell them, look, my thyroid's fine, everything's fine. They even ended up doing a sleep study on me because I couldn't think of any other thing, and the sleep study came out fine. There were a couple times that I skipped breaths, but that is normal, believe it or not. Throughout your sleep, eventually you'll skip a breath, but we all do it. It's not something we know that we're doing. It's just breathing isn't going to be exactly robotically even, it's going to happen. It's fine. It's just a matter of, for when it becomes sleep apnea, that it's happening much more often than once or twice a night. It's when you have those sleep studies, it looks at how many times you stop breathing in for the length of it. So we all do it a little bit. That's normal. So yeah, it's crazy. So fast forward to now, I'm like, do I really want to go back on this medication? Did it contribute to pushing me beyond my limit because it covered up that exhaustion? So if you look at this with the lens of neurodivergent burnout and chronic fatigue syndrome, those things are actually not good. So if you have chronic fatigue, and it's from that health point of view, something that's caused by actual MECFS, doing the things that we want to do, that we instinctively try to self-medicate because we're just dragging, and that's before it gets so much that you're stuck in bed. Before it gets so bad that you realize that you actually have an illness, you might have been just drinking enormous amounts of coffee all the time to just get through. And you might be figuring, oh, I'm just doing too much, and it'll be fine. I'll rest later. When I get that vacation, I just need to get through this month. I just need to get through this week. And years can go by that way. So yeah. So I didn't start taking it right away. And then I realized, wait a second, knowing now what I know about menopause and how estrogen plays such a significant role in the amount of, all these neurochemicals, if I increase the medication to bring my neurochemicals up, and then I go on medication that increases my estrogen, and then my body starts making more of it, so that's a concern. And then also too, I was thinking, well, if I do something, is it really fixing things? Yes, it's making me feel better, but that's the other thing with CFS for chronic fatigue. if you do things, not only should you not use something that's a stimulant, because the thing with coffee is it actually doesn't, I don't exactly know why it's not a stimulant, because it does give you the shakes and it's classified as a stimulant, but technically what it does is it tricks your body into thinking it's not tired. It tricks your body, it tells your body to stop producing that tired signal to make you rest. So it tricks you. So you feel awake and you push through and you do more, but you don't actually have more energy. You just think you do. So you're actually taking more energy than you have. So, and then also it can increase your heart rate, and it can, I can't remember if it increased blood pressure, and it's putting a stress on your body. Now, if you're a normal, healthy human being, that's not necessarily a problem. You rest and your body recovers. But if you have CFS, it's not necessarily a good thing. So that's something I've been thinking about this week. And then, so what I ended up doing was I kind of avoided it first, and then like I took it one day, and then I decided I wasn't going to take it. And then I've been kind of going back and forth, and I'm just so sick of being stuck in bed all the time that I just started taking it. And I did start to feel better, and I did start doing the things, and so now I'm kind of paying for it. So I'm learning. So basically on Tuesday, and I'm starting to reflect, like, okay, the obsessive thinking, the maladaptive coping skills, that's what I'm calling it. This is how I feel within myself, and I know we're each very, very different. But I remember having so much anxiety growing up because I was constantly spacing out, all of my ADHD symptoms, not being where you need to be on time. So I constantly have been using anxiety and like, what are you doing? What time is it? What are you doing this? Are you doing that? So I think right now that I've come into a crash season of my life where now I'm dealing with the consequences of a lifetime of this, of the toll that the sensory sensitivities have been taking on me that I didn't even realize I had because I thought I was just being too sensitive, all of that stuff. Now I'm looking at things like, oh, is there a way that I can look at, not to blame myself, but to do it in a way that has greater compassion for myself, but to be aware. Are there things that from a survival standpoint I instinctively do that are deep-rooted, that are through fear and anxiety and obsessively thinking, did I forget something? What time is it? What am I supposed to be doing? I have all these things, like all of this, I live there all the time. Do I need to learn a completely different way to be so when I am better, I don't run myself into the ground again? Like, what are things that I can do as a neurodivergent person who struggles with these things? And how do you do that? It's like deeply ingrained. So it's one of these things like, and we're each so different that this may not apply to you. This may just be me. And who knows, maybe that's like part of like my wiring. Maybe it's not like a poor coping skill. Maybe it's part of the sensitivity. Like, it's kind of like the RSD where you have the rejection sensitivity. For me, it's criticism sensitivity because I'm used to constantly being in trouble when you're a kid. In class, or, not being able to do your homework in time and always losing it. And it's like that sense of anxiety follows you. So I've been trying to reflect on, wow, what are all of the factors that have kind of run my health and my energy into the ground? So that's something I'm going to be reflecting in the next few weeks. Besides that, from a goal standpoint, on Tuesday, I did have that bupropion. and I started to kind of almost feel fine. So I'm like, okay, I'm going to pace myself. And I've been thinking, we have an we have a stationary bike in the basement, and I want to bring it upstairs and put it near the window. Like, it's a hot mess in here. I can't clean, and there's bins everywhere. It's disgusting, and I'm not well enough to maintain a house and get things back in order. But, just making sure I eat every few hours and do all the things that I need to do is a lot, so I can't do that right now. But maybe we can find a place in this space to kind of fit it up here. And then maybe what I can do, as I'm slowly increasing my baseline, maybe I can just, in the morning, as part of my waking up, maybe I can sit on the stationary bike and slowly use it for like 2 minutes or something. And do that for a week. Maybe gradually increase it. So for it not to be like the graduated exercise that they did in the PACE study, which was really harmful for CFS patients, and we'll talk about that. That was really harmful. That's really interesting, and I really want to talk to you guys about that, because I think we can learn a lot about. There were false assumptions about chronic fatigue, and they were thinking that these patients just need to be pushed to gradually increase their exercise. But it was it was designed by psychiatrists and psychologists. They totally disregarded all the medical established information about it, and they decided it must be in people's heads because they're from the psych field, and that's what they're biased to look for. These, not the psych field in general, but these particular people created this PACE study. I can't remember what decade it was. And then, of course, because their initial assumption was not correct, maybe if certain people with chronic fatigue, maybe that might have helped them if they were in a stage that they could do it, but it was really harmful. And so they had to, because they were so attached to this assumption that it was kind of like in their head, and they're just, maybe they were sick before, but they're fine now, and we just need to gradually increase their exercise, that then the medical establishment started to listen to them, and that's why, and we're still dealing with the effects of that, that whole assumption that chronic fatigue isn't real. Oh, we can't prove it. Well, they actually had proof about it before. I was shocked about this. They actually knew it was a real thing, and that a group of psychiatrists or psychologists came in and just decided it wasn't because they didn't believe it was. That's bad science. If there's actual proof that something is a real thing and you come and, like, that's nuts. And we're still suffering the effects of that, because there are still doctors, and I mean, I didn't know if it was real either, but it turns out it is. And it's a neurological and an immune system. It's a multi-system thing, and it's not helpful. So yeah, anyway, they gradually increase exercise at a rate that was probably the same for everyone. So it was forcing these patients to do more than they were able to do, and it was very detrimental. And I can't remember if people died. Maybe some people did end up dying. I remember one young woman, like, she started the PACE study being able to walk, and by the end she was in a wheelchair because she wasn't up to it, and it actually was injuring her more and pushing her back, and they were congratulating her on her progress. I'm like, that's insanity right there, that they're so attached that they've invested money and resources to this kind of thing, and they're so attached to that idea that it wasn't real, and they just need to push these patients to be more well, that here you have patients who were getting sick and injured, and actually, if your CFS is bad enough, you can do permanent damage to somebody. So yeah, the trick is you do want to gradually increase activity, but not at that rate and not in a very strict, linear, exact fashion. So recovery is not linear. You have to always assess where you're at and react accordingly. If you're doing too much, then you need to rest more. You know, I'm still learning, so I'll share with you as I learn. But incidentally, on Tuesday, because I decided to have a little bit of coffee too, which I knew I shouldn't, but I got desperate. I couldn't take it anymore. So I thought, well, I want to start living a more grounded, holistic life instead of being on my phone, resting all the time and playing video games to just numb myself. I wasn't improving anything. So I thought, well, when I make my breakfast shake, I'll go out and I'll sit outside. So I started with that. The day didn't start with me doing a whole bunch. But then when I came upstairs, I'm like, okay. I sat on that little exercise bike for like 2 minutes and I slowly got some movement. I'm like, this is good. And it started me with just doing one thing at a time. I did the dishes, which is usually a lot, in the counter. And I'm like, let me just do another thing. Let me just do another thing. So next thing you know, I did the dishes, the counter, and the trash. I didn't bring it outside because I told my fiance, I can't be lugging things. You have to like know what your energy envelope is, and that kind of crosses the line of what I can do right now. Because that's something I would be doing every day. Maybe if like one day I feel up to it, I can. And then like I took a break and I ate, but I think between having that coffee and that pill made me feel better, and I wasn't. I think it hid how I actually was. So then, and I did feel exhausted as I was doing it, but I'm like, just do this one more thing, because I was just so tired of not being able to do these things. I ended up vacuuming. I did the litter, which, if you think about it, these things seem like small tasks, but when you're not well, they end up taking up a lot more energy than you think. To actually get down on the ground and kneeling, and the way you bend your body to scoop out and then lifting, that's like too much. But I did it, and then I like had the shakes, and I'm like, crap, I shouldn't have had coffee. So the next day I didn't do all of those things, but that was the day that I showered, I shaved, I washed my hair, I got dressed. I actually did the dreaded call where I called HR asking, saying, I don't think I can come back. And I've been avoiding that because this is not how I want to leave my company. I wanted to cry. I talked to the woman. I'm like, I don't know what to do. And technically they could extend my leave of absence if I gave them documentation from my doctor that I have this. But I told her, I said, you know what, I thought about that too, but if 2 years ago I took a leave of absence and I came back to work in 2024 after that burnout, and I reduced my 2 days a week to 1 day a week, and I still throughout all that time would have to rest 1 to 3 days after 1 day a week, and then now this, and I haven't been getting better, that's a long time. That's like 2 years. So even if I did extend my leave of absence, I have no idea. And as it is, I'm now so trying to navigate like doctor's appointments and different tasks that I have to do because of time sensitive things. My phlebotomy license is going to expire in 2 weeks, so now I have to do CEU credits. I have to try to get 10 credits and do classes over the next 2 weeks while having a chronic illness. And I might lose my license. Now, will I be a phlebotomist someday? I don't know, but I'd like to at least try to keep it, because I'd like to keep that option so that when I do learn how to recover and maintain and learn what all of this means to me so that I can start figuring out what it means to thrive and what I need to do to manage my health to stay healthy. I'd like to keep that as an option. So, yeah, I did talk to them, and I'll do a whole nother thing about this. I had to write my letter of resignation, and I don't even want to think about it right now. I haven't even processed this because I'll just start crying. But yeah, yesterday, if I do a shower in a day, sometimes that's a lot. Now my baseline's been going up slowly, so I've started to almost feel a little bit normal. Maybe I can start doing errands here and there. But I think after those 2 days and it being so intense, yesterday I did the shower and dress, which is a lot for me, and I had a counseling appointment, and I called HR before talking to my counselor. I don't know why. I've just been really putting it off. Then I rested and had lunch, and then I had to draft my letter of resignation. And so those last 2 days have been super intense, and now I'm just exhausted. And it's been a couple weeks now since I've seen my immunologist, and I'm supposed to go to the hospital and have a chest x-ray. I think he wants to look for some inflammation there. I don't know. It seems kind of random to me, but I'm going to trust him, and I'm supposed to be trying to find a way to... Hi, girl. She's trying to bite my calendar I'm holding. Hi. See, I was like going to tell you, I was like reading from this, and she came up and started biting it. Hey. Hi. Yeah, she's like, pay attention to me. Anyway, I'm sorry to ramble about all of these things, but this is intense. I've been continuing with my, tracking what I eat, and I'm trying to not make it, technically, like if you look at somebody like Toby Morrison and the CFS Health, I agree with him. Stressing about food is not something that's beneficial to you if you have chronic fatigue, because stress will it adds to that allostatic load and it can make you sicker. But because I have time blindness, because I'm neurodivergent, it's like I'm doing that very thing to make sure I do eat, because I will forget. So I haven't figured out a way to simplify it for myself yet. I feel like I'm making things more complicated than they are. But yeah, it hasn't even registered in my brain that I said in my letter of resignation last night, I'm going to have to text my boss. I haven't been able to go down and even talk to him. This is not how I wanted to leave. It would be really nice to say bye to people that I care about. So I'm really sad about that, but this could probably give me the opportunity to just focus on my health now. Anyway, I'm sorry if I rambled a lot that time, but there's a lot. And I was talking to my therapist about this. I'm like, why are we responsible to do administrative work of filling out paperwork, driving it from one place to another, dropping it off, to sign off, or them to just transfer records? Can't they just do it? I know they're protecting HIPAA and all of that, but that's the ADHD tax right there. I don't have the executive functioning right now to be able to do all of that. My doctors don't talk to each other because they're different organizations, and it's just ridiculous. I didn't want to deal with it. So another thing about executive functioning is it's not even being able to think straight to go through all of these planning and administrative tasks. It's the prioritizing. So I'm going to start a new conversation thread with Gemini to help me prioritize these things and figure out a way that I can get all these things done in a time-sensitive manner, I just don't even know if I could do all of these things if I was well. And my cat's due to have her rabies and her other shots in a couple weeks, and I didn't realize it was this month. As it is, I'm going to have to borrow money from my mom to renew my license. And I don't know what I'm going to do. I still have to figure out, do I go in Social Security disability? Do I can't have an income. People shouldn't be supporting me if I have a disability from this chronic illness. Like, I don't even, all the steps, what a nightmare. But anyway, I'm happy that I think my baseline's going up, but I'm not sure if it's the new medication making me think it is. So that's tricky. And I am paying the price for what I did the last couple days, but especially since the dishes are dirty again, it's like, why? They have to get done, and I can't expect my fiance to do it all. He works so much. Anyway, so that's what's going on this week. It's a lot, and I'm not talking about this stuff to vent or complain or anything like that, but I find it very interesting that I'm going to have to figure out what kind of supports I can create for myself so I can break these things down and space them out, but yet somehow be able to do them by due dates. I just want to cry. It's a lot. Anyway, my health is good. Well, compared. And I do love you guys. I do think about you. I hope you are doing well. And maybe as I go and I try different things, maybe sharing that with you might be helpful. And I did have to reschedule. I have an appointment for, my phone's going to die, for neuropsychological testing. And then the appointment for my initial appointment's in July. And then once I do that, I might be able to see about getting an assessment for my neurodivergent. So we'll see. It's a lot. I'll see you guys soon. I hope you're doing well. Have a really awesome day. Do something kind for yourself. Rest if you need to rest, and just know you're not alone. And I love you guys. I'll see you soon. Bye.